Hello friends, welcome to Swati's tutorial, and today we are going to talk about hyperemesis gravidarum. Okay? So we all know that vomiting is so common in pregnancy that it's even considered as a sign of pregnancy. Okay? So nausea and vomiting, which is so common in pregnancy, but sometimes it becomes excessive or it becomes so severe that it is no longer considered as normal. That condition of severe morning sickness or severe vomiting is called as hyperemesis gravidarum. So that is what we are going to talk about today in our class. So what is the definition of hyperemesis gravidarum? It is a severe type of vomiting in pregnancy which has got deleterious effect on the health of mother and incapacitates her in the day-to-day activities. That means in normal pregnancy, almost everybody experiences nausea and vomiting, but it is not that severe to hamper her day-to-day activities. But if a lady is suffering from hyperemesis gravidarum, the vomiting is to such extent that she cannot perform her day-to-day activities. So that is the definition of hyperemesis gravidarum. Severe type of vomiting which causes deleterious effect or bad effect on the health of mother and does not allow her to perform her day-to-day activities. Now let's talk about what is the etiological causes. What leads to severe type of vomiting in pregnancy? The exact causes are not known, but there are certain risk factors which increases the chance of hyperemesis gravidarum. So what are they? The first one says that it mostly occurs in first trimester of pregnancy. Why? Because in first trimester of pregnancy you have more of HCG hormone, human chorionic gonadotropin hormone. This hormone is the reason for nausea and vomiting sensation. So that's why it says that in first trimester you are more prone to get hyperemesis gravidarum if you have more HCG hormone. Second, it states that if you have this problem in first pregnancy, it can again repeat itself when you conceive for the second time. That means if a lady has had hyperemesis in her first pregnancy, she can have the same complication when she conceives for the second time as well. Next, it states it has got a family history. That means hyperemesis gravidarum sometimes runs in the family. As if the mother has had the problem, the daughter is supposed to have the problem when she conceives as well. So it runs in families. And the next etiology is it is more prevalent in hereditary mole and multiple pregnancy. So it says that in molar pregnancy and in multiple pregnancy, that means if you are having twins or more, you are more prone to get hyperemesis gravidarum. That is simply because in molar pregnancy and in multiple pregnancy, your hormone levels are higher. You have more of HCG hormone, more of progesterone hormone. Therefore, the chances of hyperemesis gravidarum is also more. And the last risk factor is it is more common in unplanned pregnancy. It has something to do with your psychology. When a mother is not mentally prepared for the baby, the chances or the risk of hyperemesis gravidarum has been found as more. Now let's talk about some of the theories which try to prove why it happens. The first theory is of hormones. So as we have already discussed, some of the hormones like HCG and progesterone plays an important role. If a lady is more sensitive to HCG hormone and progesterone hormone, the chances of severe vomiting is very high. Next is psychogenic, which also we have discussed. Psychogenic is something with mother's psychology. If a mother is not mentally prepared, if she is having some financial, social, emotional problem, which is not supporting of her pregnancy, if she is not having enough family support, if she is not financially strong enough to support the baby, or if it is an unplanned pregnancy, in such scenarios, we have seen that the lady is at risk of hyperemesis gravidarum. There are also some theories which says that dietary deficiency of vitamin B6, B1 and protein can also cause the hyperemesis gravidarum. Okay. Then one theory says that allergic or immunological causes. In this it says that when the baby is having genes of both father and mother. So sometimes what happens is when the genes of father is not accepted properly by the mother's body considered this as something as allergen or immunological causes, it can also precipitate hyperemesis gravidarum. Then as last theory says decreased gastric motility in pregnancy is basically because of the effect of hormone progesterone. The sole function of progesterone is to relax the muscles of the body. It basically works on the uterus so as to prevent the uterine contraction prematurely. But sometimes this hormone also acts on other muscles of the body, like the muscles of stomach. As a result, the sphincters of the stomach are relaxed, which can cause increased vomiting. So decreased gastric motility is also a theory because of the effect of hormone progesterone. Now going to the clinical course. So when a lady suffers from hyperemesis gravidarum, the clinical course runs in two ways, early and late. The early clinical course will be, the woman will have vomiting throughout the day. Her normal day-to-day activities will be curtailed. That means she will not be able to do her work properly. We have already discussed that in the definition. And there is no evidence of dehydration and starvation. In the early signs and symptoms, the dehydration and starvation will not be present. But in the late course, when the hyperemesis is continued for some duration, and in the late course, the woman will have evidence of dehydration and starvation as well. So that is a very critical condition, and she needs to be hospitalized and taken proper care of in the late clinical course. Going to signs and symptoms of women. Symptoms will be vomiting is increased in frequency with retching. Urine tendency is diminished even to the stage of oliguria. Epigastric pain will be present in the woman. Constipation may appear. These are the symptoms. And what are the signs which you check in patient? We will see dry coated tongue, which is a sign of dehydration, sunken eyes, acetone smell in the breath, tachycardia, hypotension, rise in temperature, and jaundice. This is a late feature. This all signs and symptoms are related to the signs of dehydration and starvation. Now coming to management, how we manage such cases. The principle of management is, first you have to control vomiting. Second, you have to correct fluid and electrolyte imbalance and other metabolic disturbance which is present in her body. And the last is prevent or detect the complications at the earliest. So these are the principles on which we are going to work. Control vomiting, correct fluid electrolyte imbalance, and prevent any kind of complication. On admission, the following treatment protocols are followed. At first, an IV line is established and fluid is started to prevent the signs of dehydration. And then we start with the drug therapy. We start with antiemetic drugs like promethazine and prochlorpromazine to prevent the vomiting. Hydrocortisone is administered if the woman is having hypotension and intractable vomiting. Nutritional support is provided with vitamin B12, B1, B6 and vitamin C. So this is the treatment protocols, and she has to be hospitalized as long as she is not able to take anything per orally. When can we remove the IV fluids? Is once the woman is able to tolerate food orally and the signs of dehydration and starvation has subsided. In that condition, we can take out the IV fluid line and give food orally to the mother. These are the protocols. And what are the clinical features of improvement? When will you know that the woman is not better? Is when you see subsidence in the vomiting. Vomiting will reduce. Feeling of hunger will come back and she will keep the food down. She will be able to eat and keep the food down without vomiting. The face, the look comes better, like in the sunken eyes, the dry coated tongue and all that features will go and she will start looking better and healthy. Disappearance of acetone from the breath and urine will be found. Normal pulse rate and normal blood pressure will return, and the urine output will also become normal. When a woman comes to this state, it's said that she is now no longer needing hospitalization and can be discharged with indications that the symptoms recur. She has to come back. So this is how you manage. But in some cases, even after giving all the medical management, if there is no way you can control the vomiting and the woman's condition, the health is deteriorating, in that you have no other option but to terminate the pregnancy. So hyperemesis gravidarum may sometime even lead to the complications, like in such a way the woman cannot continue with the pregnancy and the only treatment is to terminate the pregnancy. So that's all for today's class. Thank you so much for watching.